Hello, good morning. I'm Dr. Ganesh Nallur Shivu, Senior Interventional Cardiologist at Aster CMI. Today we'll discuss about leadless pacemaker and compare it with the traditional pacemaker. For traditional pacemaker, we have to make a pocket in the infraclavicular region of the patient and a wound is there, and then leads are connected into the heart. So there is risk of infection and there is risk of bleeding. However, in patients who are elderly, high risk of infections, when there are problems with access, cancer patients who are particularly at risk, this may be a problem because the pacemaker that we actually implant can get infected. So leadless pacemaker is a boon to all these patients. The leadless pacemaker is the size of a small capsule and it's inserted through the right groin or through the femoral vein, and it's inserted into the right ventricular septum, and this acts and does all the job of the traditional pacemaker. The main advantages being that there is no open wound and there is the risk of infection is nearly negated by using the leadless pacemaker. So we have this patient who was an elderly patient who was immunocompromised and would be a very high risk candidate for a traditional pacemaker, who went on to have a leadless pacemaker and has made a complete recovery in less than 24 hours period. So the fast recovery is also a major advantage of the leadless pacemaker, and definitely this has revolutionized the treatment of patients with complete heart block. Thank you.
Hello, I'm Dr.Sanjay, Bhat, Senior Interventional Cardiologist at Aster CMI Hospital. So we have this patient who came with a very low platelet count. Platelet count was only 3000 and she had multiple bleeding manifestations. She was having a complete AV dissociation, so heart rate was very low and she required a pacing. So immediately we did emergent temporary pacing and subsequently she required a permanent pacemaker. Usual situations we go for a pacemaker which is surgically implanted under the collarbone, and the wires are passed from the subclavian vein in the shoulder into the heart, and the wound is closed, and it usually heals off in a week to 10 days time. But when a patient has a low platelet count, there is risk of bleeding and the pocket can get infected and the bleeding can persist, and we may have to explant it, so it will be a total failure. So in this situation, a leadless pacemaker is a lifesaver. A leadless pacemaker is a small device which we place from the thigh, from the femoral vein, or from the neck, the jugular vein, and it is directly tracked down into the right heart chamber and is attached to the ventricular myocardium. So this is a short procedure, hardly takes half an hour. We had this lady who completely recovered following this procedure and didn't have any trouble of bleeding manifestations and is ready to go home in a day's time. Thank you.
नमस्कार। इधर के डॉक्टर लोग सब बहुत बहुत अच्छे हैं और नर्स की टीम भी बहुत बहुत अच्छी है। डॉक्टर गणेश, उन पूरे डॉक्टर भी बहुत बहुत अच्छे हैं, मेरा बहुत ख्याल रखे। कल शाम में ऑपरेशन हुआ, अभी मैं उठ के बैठी हूँ आराम से, बहुत अच्छा चल भी रही हूँ। अच्छा चली, 2-4 बार चल के आके बैठी हूँ। बहुत बहुत धन्यवाद सभी का।
I'm here to share my experience of Aster CMI Hospital being an attender. Actually, my mother had a complete heart blockage. Air Force Hospital, Command Hospital referred us to here. When we came here, my mother's condition was literally very pathetic. Her heart rate was very low and we were really very worried. But thanks to the doctor and the doctors and the team, emergency team over here, they were really prompt. As soon as we came here, immediately without wasting any time, they took action. And now the Dr. Ganesh Nallur and his complete team of cardiology, they have supported us a lot. They asked her to implant the pacemaker. Initially we were not knowing what the pacemaker is, how it works and all, but by regular counseling, support and the clearance of doubt, it cleared all our doubts, and finally yesterday night she got implemented the pacemaker. It was just a half an hour procedure. It was not even a surgery, I must say. It's just a half an hour procedure, and today morning by not even 12 hours is over. My mother is absolutely fine. She is on chair. She was walking, in fact. I really thanks to the entire team of Dr. Ganesh Nallur and his complete cardiology team, nursing team, who have taken such a good care of my mother, and I'm really happy and grateful to the hospital.
We'd like to say, like, this is the best hospital we have seen ever, and which is facilitated with everything. You no need to go to anywhere outside for any kind of reports, any kind of things. Here staff, doctor, facility, everything. Even at night 3 o'clock, doctors are there. You always, I'll refer people to come and visit Aster.
I must recommend to all the viewer, whoever are seeing this, in case of emergency, don't think twice. Just come to Aster CMI. You will be happy with the timely support what you will get over here. Thank you.
Thank you.